Governor Newsom, welcome to the Daily Social Distancing Show. California has quickly become one of the biggest stories in and around the coronavirus outbreak, specifically because of how the numbers have grown, but also because of what the state has been doing to combat coronavirus. Talk us through the initiative that just kicked off today. What is happening with regards to expanding healthcare and beds for people who need it?
So we have to increase our healthcare capacity within our hospital system by 2/3. And in order to do that, you need three things. You need the physical spaces, you need all the protective gear, the N95 masks, the ventilators, but you need people at the end of the day. And the most precious resource are people. And as a consequence, there's no way we can meet the moment unless people that are recently retired or people that are in the middle of credentialing and licensing start to enter into the workforce. So we just did a big push today to create a health corps and create incentives and create the kind of flexibility so we can get thousands and thousands of phlebotomists and pharmacists and paramedics and EMTs, nurses and doctors into the workforce over the next few weeks.
So that's what you're doing with regards to fighting coronavirus on the ground. But as you said, you need the equipment that the people are going to use. One of the most confusing conversations happening right now in America is the battle between governors/states and the president/the federal government. In your opinion, where is the federal government falling short, and where do you think states need to step up and do more to fight this pandemic?
We have not received any ventilators in a state of 40 million to meet our needs. There were 170 ventilators that went directly to LA County. Just a couple days ago, they opened the boxes and found out that none of them worked. So rather than complaining about it, we decided to ship them from LA. I brought them into Silicon Valley, and literally within 72 hours, all of them were fixed, and they've already been sent back down to Los Angeles. It's a way of making this point and answering your question. We're not waiting around for the federal government. We need more support, but at the end of the day, we have to be resourceful in our mindset and our approach and use all the tools in our toolkit. All of that being said, I want to thank the president in this respect. We got that USNS Mercy, that large hospital ship, 1,000-bed capacity into LA a couple of days ago. And that's the kind of thing we do count on the federal government for. Beyond that, we're going to be as resourceful as we can be.
One of the things you were given credit for is being one of the governors who acted earliest with regards to the coronavirus. You know, you told people over 65 to stay at home. You then implemented a lockdown before many other states did. You've still come out and said you are worried that up to 25 million Californians/Americans could get the coronavirus. How do you think you are looking right now? Do those numbers still look as dire, or do you think that you've done enough to stave off the pandemic from growing?
Well, good enough never is. You don't run the 90-yard dash on this. And I think the biggest mistake we can make is having done all of this good work, the stay-at-home orders, having people practice safe physical distancing. I prefer physical distancing to social distancing because a lot of young folks are confused by social distancing when they're all socially connected, but we need them physically apart. The fact that we're practicing that at scale, we think has bought us time. But we're not out of this by any stretch of the imagination. Let me be specific. In just the last 4 days, we have tripled the number of people in our ICUs. We've doubled in the last 4 days the number of people in our hospital system. But we do believe that early call on stay at home and physical distancing bought us a few days, maybe a week or two, that allowed us to start getting our resources in place to meet the moment.
Okay, and then finally, I know you have to get back to work. One of the biggest issues we're seeing around the country and the world is the issue of people who are in prison and how states and countries deal with that. Because of the spread of coronavirus right now, being in a closed space is one of the worst things that you can do. Prison is exactly that. Are you looking at releasing numbers of prisoners, and how do you balance that? Because obviously some people in the populace would say, well, do prisoners get to come out because of coronavirus? And how do we balance safety versus the risk and the safety of human beings who are locked up?
This is a moment where we need to be sensitive to those that are locked up, particularly in a system like California that went on this incarceration binge in the 1990s with 3 strikes and mandatory minimums. And we grew our prison population as we were cutting our support for our higher education system. So we've been trying to do more and more to move in a different direction. But now we have 18 staff. As I talk to you, we have 18 staff now been tested positive for COVID-19. We have a number of prisoners, 4 as I speak to you, that have been tested positive. So we're practicing social distancing, physical distancing in the prisons by reducing visitation, eliminating it, by getting people to eat their meals in their cells, by doing more to isolate our prisoners. But in addition, and this goes to your question, we are looking at people that are coming up close to their parole date, that have parole plans, and make sure we match them with probation and then get them paroled earlier. And we're doing it in a very thoughtful and judicious way based upon public safety, not being flippant about this, not just saying, hey, you people randomly, we're going to send you home, but people that were already in the queue and just fast tracking that to decompress the system by thousands and thousands of others. And finally, we're reducing the intake into the system for people that were coming into the prisons. We are now stopping and capping that, which then puts similar protocols at the county level for jails to then start moving out their lowest offender population, people that are nonviolent, non-serious, non-sex offenders. So we're doing it as thoughtfully as we can, but it's a very serious thing for the rest of the country to protect the folks, staff, and inmates within the system.
Before we go, is there anything you would like the public to do? Is there anything people can help officials with? Because we always ask from the top down, but what can we be doing to help in this situation?
There's nothing more potent and powerful than the tool at hand for every single person watching, and that's practicing physical distancing. You know, not going to the beach or playgrounds or parks when tons of other people are out there, not going on a jog when those jogging paths are full. If we do that, there's nothing more significant to bend the curve, and that's heroic. Everybody has the capacity. It's decisions, not conditions, that are going to determine the fate of this virus. And so when you're reading all of these programs or watching programs that say, here's what's going to happen, that's nonsense. Nothing is predetermined. We have the capacity to bend the curve by making better decisions. And so please practice physical distancing and don't buy for a second that we can cut the parachute before we've landed.
Governor Newsom, thank you so much for your time. Good luck out there.
Great to be with you.